Many people think that dark circles are simply caused by excess fat. However, the issue is not just about the fat itself. Beneath the fat, there is a hollowed area where the tear trough is combined together. In conclusion, the bulging fat and the hollowed area below it create a noticeable shadow. That is why, from the side, it looks uneven and bumpy. It becomes even deeper when you smile, and that is why patients say they look much older or constantly look tired. It is not just a problem of bulging fat. The skin and muscles also lack elasticity. What happens when that occurs? The fat protrudes and sags downward. That is also part of the problem. Vessels and pigments in the skin, and most importantly, the bulge and the tear trough, coexist, causing the skin and muscles to sag, which makes the shadow even darker. For those with thin blood vessels, or those with thin skin where vessels show through, or those with hyperpigmentation, the problems are quite complex like this. Through the inner conjunctiva, we performed fat repositioning surgery. We spread the fat out thoroughly across 5 fixation points. What happens after it's spread out? The hollowed area located in the lower tear trough is flattened. The bulging fat is smoothed out and the hollowed area underneath is finally filled. But since the face is asymmetric, one side may be filled slightly less. In those specific cases, inside the repositioned fat, we perform a microfat graft with a very small amount. Since the patient also lacks some elasticity in the skin and muscles, the sagging in the lower area is resolved, the bulge is filled into the hollow using the patient's own direct fat, and any deficient areas are supplemented. Even after repositioning and performing the fat graft, vessels might still show through around the tear trough area. A dark, thin line might remain. That is actually a skin-level issue. We use specially processed fat, known as concealer fat. When layered thinly under the skin, the result comes out like this. The photo looking upward is the same, and look at the appearance when smiling. It looks much cleaner, doesn't it? Sagging skin and wrinkles improved a lot, and if you watch the video, it looks cleaner and has a lifted feel. That is why a partial incision is extremely helpful. For patients like this, please look at these photos. It looks much more refined. There is a clear lifting effect, yet only a partial incision was made. Scars from the partial incision are not visible. The advantage of this surgery is that the recovery process is very fast.